Hello, I'm Dr. Jim Coyle, and this tutorial for social work practice with families focuses on doing family therapy. This tutorial continues where we discussed assessing families, but now we're going to focus on how do we go from assessment to identifying family goals and interventions. When you're doing family therapy, it's important to consider what you need to do, what you have to accomplish to be effective, and to consider that you've already learned a lot of this from your personal work experiences, your previous courses, and what we've learned so far in this course. The process of family therapy includes first identifying the family patterns. It's similar to doing an individual assessment, focusing on individual functioning, but in this regard, a family assessment focuses on how family patterns influence family functioning. You formulate a working hypothesis, which is related to the presenting problem. It's also related to the therapy model you're using because each therapy model conceptualizes how families effectively function. And certainly you're going to pay attention to the individual family patterns and dynamics that you're seeing as you're observing what the family is presenting. You test the hypothesis with questions, asking the families to reenact things by observing the family doing the problem, but maybe in some different ways, as well as getting family feedback. One of the more effective things to do is to say, it seems to me that this is what's happening in your family. What do you think? Families will tell you whether they think you got the right idea, or they'll let you know what are some options if they don't think you have the right idea. It's important to negotiate change. Like individual therapy, family therapy focuses on working with the clients to help them identify what goals are going to fit for them, as well as the interventions that fit. So there's a collaborative process that goes on. And finally, practicing change is important. Talking about changes in a counseling session and assuming that the family will just be able to go home and do that is not the best way to think about it. It's not the best way to accomplish this. During the counseling sessions, you need to work with the families to actually do the changes that they're expected to do at home so that they can get some coaching from you and the ability to talk about, is this going to work for them or not? It's important to determine what the family needs. You do that by asking questions of all members to get a sense of whether the family agrees on needs or whether there's disagreement. And if there's disagreement, that becomes the first goal, is helping the family negotiate what they want to do together. You need to observe the patterns of interaction. It's actually much more effective to see what the family members do rather than to ask them to think about what they do and then tell you about it. Joining the family and working in a collaborative process is important because it helps the family feel, that they've been accepted by you and that you understand what's going on. Need to choose a change model, first order change, second order, or third order change, and we're going to talk about that in a moment. It's also important to assess stability versus adaptability. When families are really vulnerable and there's a lot going on with them, you may need to put in a lot of supportive resources before you can begin talking about how do we change family patterns, because it may be important to maintain even the dysfunctional homeostasis so that families can get by and be stable rather than feel totally overwhelmed by change that comes too quickly. You choose the change methods as well as the techniques. You have to evaluate talking versus doing. Talking is usually about insight. It's about education. It's about thinking. Doing sometimes is more effective because it's about changing behavior. It's about doing things differently. And in some models, asking families to try something different is based upon their trust of the therapist and doing something and then deciding, yes, this does work better without necessarily having to talk about why it's working better. Homework can be very important, although it's really important to recognize that homework works better when you've rehearsed it, when you've tried it out in a counseling session, rather than just give it to families to do on their own. Reenactments, challenges, ordeals, rituals are all types of interventions that can be helpful so that families begin to be provoked into doing something different. I always remember going to a conference, and Paul Watzlawick, who was from the Brief Therapy Project in Palo Alto, California at the time, said that families come in and they're doing the same thing over and over again. Our job is to find something different for them to do. And I think that that's a strategic standpoint that is very helpful. Okay, I mentioned that I was going to talk about type of changes. First order change helps the family use their existing family characteristics and skills to resolve the problem. And that suggests that their problem-solving skills and their relationships are sufficient to manage the current stressor, and that happens a lot. Sometimes families will come in and talk to you about what's going on, and what you really are getting is I think you're doing the right thing, you just need to give it a little bit more time. Families are often just need the reassurance that they're doing what they may need, or they may need to be reminded they did this stuff in the past and they were successful, give it a try again. Second order of change helps families change their structure, roles, relationship patterns, problem solving in order to solve the problem, depending upon what they need to change. For example, family triangulation or coalitions in families may need to be changed in order, because they keep the family stuck in patterns. And so you may need to help families change that. Once that's changed, they can pretty much go and resolve the presenting problem. And that's what you're trying to help them accomplish. Third order change addresses influencing factors in the environment. And this is something that is more recent in terms of being discussed. But neighborhood crime or community racism, when they affect the family's presenting problem, may need to be addressed in some way. At least, how is the family going to cope with it if there's no way to change that? But it needs to be part of the process. I have compiled a list of a lot of different suggestions, techniques, ways of doing things when you're doing family therapy, and it's in Blackboard Lesson 4. And I suggest that you review that, because rather than just sit and talk to you about all of that, that gives you an opportunity to read these suggestions and then think about, how do they fit with what you've already learned? How are they new? How could you do them? And then you can decide how much time you need in order to kind of get a sense of how these are going to be helpful for you. Jot down your reactions, your questions, your ideas about using these methods, and we'll discuss these in the in-class discussion. Another aspect that's important is that in family counseling sessions, it's important to pay attention to time. You really need to leave time at the end of the session for discussing what the assessment is, what you see going on with the family, and having a conversation with them about that. Planning next steps, perhaps an action plan or homework. As I mentioned, homework is better if you have time to rehearse it a little. At the end of the first session, if the family believes that they can follow your suggestions, such as first order change, then they can choose whether to schedule a follow-up appointment or not. They may not need one, or they may decide to try things out and then call for an appointment if they need it. For second or third order change, you want to plan an order for interventions and objectives. You know, what are you going to do first? What are you going to do next? What are you going to do third? And talk with the family about how this goes and a time frame for how long this is going to take, at least guessing what they need to do so they have a sense of what they are, kind of the commitment that they're making. For follow-up appointments with families, you begin by reviewing what happened since the last session, particularly the homework. This starts with reviewing the progress they've made on the presenting problem, although it may also include that other things have happened since the previous session, and you may need to adjust the interventions or what you're going to work on and what order you're going to work on things. You discuss and rehearse methods for addressing the next treatment goal. That's what happens during the counseling session is what do you want to work on? Let's give it a try. Let's decide how it's going to work and whether they feel comfortable with it, and then they practice it at home. It's important, even for follow-up appointments, you leave time at the end for clearly describing what the family will do following the session so that they get a sense of it's really clear, and ask them to make a commitment to do it. It's much more likely that something's going to happen if you spend this kind of time with them. In terms of ending your contact with families, which the literature calls termination, it's helpful if you plan it from the beginning, and it's a focus on goal attainment so that you're talking about my goal with working with you is to help you resolve your presenting problem in some way. You make the best use of each session since families have lots of other things going on in their lives and they may discontinue. So you want to be sure that you are following a plan and at least doing the things that seem right in that moment. The family has a sense of what's going on. For planned endings, when they've come to the point to say, okay, we seem to be doing okay, it's helpful to take an inventory to show what the progress is, what they've been able to accomplish. Sometimes families don't realize how much they're doing now that's different and how much progress they've made. It helps to review that. Give positive feedback. Look at all the work you've done. You've done such a good job, and look at how you're handling things now. It's so much better. Discuss the future, how to maintain progress, what to do to manage future problems, not just the presenting problem, but what about future problems? How can they use some of the same skills? And how can they know when to return for more counseling or therapy if something comes up that's a little bit beyond them? This can be a very helpful way to end your contact with a particular family. Okay, I want you now to continue to consider an individual task. Remember back to about those clips from What's Eating Gilbert Grape. You talked about those in the last classes that we had in terms of who they were and what they were dealing with and doing an initial assessment. Now jot down your ideas. Your initial assessment was based upon a small group discussion during the first weekend. Consider the possible family goals for the Grape family to consider and the interventions that may be related to those goals. Consider what model they fit in, or do they kind of go in between models. I'll give you an opportunity to talk about what you would do intervention-wise, what you would actually do once you've assessed what the family is able to do, what they could do. What interventions would you talk with them about? And we'll do that in a small group discussion. I'll also have a small group discussion where you can take what you've learned now about doing family therapy and continue the exercise that we did, the role play exercise in small groups with the Blue family. And so you'll have an opportunity to take that a step further from assessment into, okay, what would we do intervention-wise to kind of help this family decide, okay, how is mom going to deal with the daughter's conflicts about going to their father's wedding and conflicts between mom and daughters about behavior? So we can talk about all of that, and we'll continue that in some small group discussions in the next class. So I'll talk to you then.